Dr. the Honorable Christopher Tufton, Minister of Health and Wellness, Dr. Joy St. John, Executive Director of the Caribbean Public Health Agency, Dr. Magdalena Pachowski, Director of Cancer Registries for the Bloomberg Philanthropies Data for Health Initiative at Vital Strategies, Dr. Heather Armstrong, Head of Chronic Disease and Injury Prevention Department and Principal Investigator at IRAC Caribbean Cancer Registry Hub at CARFA, Dr. Simone Spence, Director of Health Promotion and Protection Branch in the Ministry of Health and Wellness, Dr. Tamu Davidson, Director of Non-Communicable Diseases and Injury Prevention, Dr. Gloria Gallardo, PAHO Advisor on NCDs and Mental Health, Chief Nursing Officer, Mrs. Patricia Ingram Martin, her Deputy, Mrs. Gillian Mason Quarry, other directors of the Ministry of Health and Wellness, directors of the Caribbean Public Health Agency, and officers of Vital Strategies, distinguished guests, ladies and gentlemen, members of the media, our Caribbean family, online and in person. Good afternoon, right? Yes, good afternoon. On the cancer, I mean, you know. Good afternoon, right? And welcome those online and those who are in person with us. My name is Stephen Davidson. I'm the Director of Public Relations and Communications at the Ministry of Health and Wellness, and I'll be serving as your Master of Ceremonies for this very important function. And of course, we're saying persons are joining us not just in Jamaica, but they are online, on Zoom, on our Facebook and our Instagram page. And so we have members from the Caribbean who are joining on as we launch this project that is centered on using the DHI S2 to strengthen cancer registration data systems in low-resource countries. I would say from Rwanda to Jamaica, right? And I have it on good authority that Jamaica is the second country to be using this software. We're not used to coming second, right? We're not used to second place, but it's still historic. We can still big up ourselves. For our, you see, we always find a way. First in the Caribbean. Number, our Caribbean people are here, you know. Hold on. We have to be careful. But not only Jamaica, but the Caribbean, we are committed to reducing mortality due to cancer by a third by 2030, right? We have that target that we have set to reduce the mortality rate. And of course, we want to enhance that through data collection and through this software. Of course, we are hosted today by the Health Promotion and Protection Branch in the Ministry of Health and Wellness. And I want to welcome our esteemed director for the branch. She's a former medical officer of health for Hanover, right? True? Former director of family health services in the ministry. And now she's serving as the director of health promotion and protection. Welcome, Dr. Fabulous. Dr. Simone Spence. She'll give the official welcome.
Listen, I can always count on Stephen for the introductions. Thank you, sir. So, Mr. Stephen Davidson, Chairperson, Dr. the Honorable Christopher Tufton, Minister of Health and Wellness, Dr. Joy St. John, Executive Director of the Caribbean Public Health Agency, Dr. Heather Armstrong, Head of the Chronic Disease and Injury Department, and Principal Investigator, IARC Caribbean Cancer Registry Hub at CARFA, Dr. Magdalena Pachowski, Vital Strategies. I hope I did not mess that up, Doc. So sorry. Dr. Gloria Geraldo, PAHO Sub-Regional Advisor for NCDs and Mental Health in the Caribbean region, other directors of the Ministry of Health and Wellness, other team members here and online from CARFA, specially invited guests, members of the media, ladies and gentlemen, good evening. This is similar to Stephen. I still like to hear. It's not a rhetorical question. So, you know, when we say good evening, we still want the feedback and the response, right? So we're going to do that again. I won't go through the long list, but I'm going to say good evening again, and then I expect to get a good evening, right? Good evening. Thank you so very much. I really appreciate it. A warm welcome is extended to everyone here this evening for the launch of the project using DHIS2 to strengthen cancer registration data systems in low-resourced countries from Rwanda to Jamaica, the second such to happen in the world. Cancer registration is critical to informing health promotion efforts, and the Ministry of Health and Wellness looks ahead with great anticipation at the profound impact the District Health Information System 2, or DHIS2 oncology module will improve cancer registration here in our country. Cancer registration systems, an essential component of a comprehensive cancer prevention and control program, collect comprehensive data on the incidence, prevalence, and trends of cancer in our population. This data allows health promotion professionals to identify high-risk groups, geographic areas with elevated cancer rates, and specific types of cancer that are on the rise. This information is essential for setting priorities and deploying resources effectively. The Ministry of Health and Wellness, once able to access national high-quality data, will be able to identify potential causes and risk factors associated with specific types of cancer. The data, once analyzed, will direct specific health promotion efforts that will be focused and targeted to produce maximal results. The anticipated data to be collected using the DHIS2 software will further assist in our ability to monitor the effectiveness of our health promotion activities, ensure the correct and precise allocation of resources, and above all, direct our interventions at improving early detection across Jamaica. The Ministry of Health and Wellness stands firmly behind this statement: early detection saves lives. Today, we believe that this launch will directly benefit the Jamaican people and be an advancement for cancer registration in Jamaica and definitely save lives. Thank you all for coming and for being a part of this initiative. The Ministry of Health and Wellness looks forward to continued and strengthened partnership with CARFA and all the persons who are present both here in person and online. We also look forward to the national improvements in cancer surveillance. Thank you.
Thank you very much, Dr. Spence. I know you feel welcomed. Yes? Yeah, right? Yeah, but MC yes is a rousing yes. So we're going to take greetings now from our partners. And I think we love when Dr. St. John is in Jamaica, right? We do enjoy her company. And so we're going to hear greetings from Dr. St. John. She's the executive director at CARFA. So please make her welcome.
Thank you very much, Mr. Davidson. So, bear with me. I'm going to do the protocol list. Dr. the Honorable Christopher Tuff. Vital Strategies Representative, Dr. Heather Armstrong, Head of Chronic Disease and Injury Department and Principal Investigator of this wonderful project. Miss Sarah Cannell Crooks, I want to recognize her because she's the coordinator of the IARC Caribbean Cancer Registry Hub, and in their absence, I want to recognize the steering committee of the hub and the Rwanda Cancer Registry representatives. Ms. Danielle Walwyn, Advocacy Officer and Coordinator of the Youth Arm of the Healthy Caribbean Coalition, representatives from the local cancer societies, staff of the Ministry of Health and Wellness of Jamaica, CARFA staff, members of the media, ladies and gentlemen, good evening to all of you. It is with deep satisfaction that I bring greetings on this occasion to mark this particular project launch, using DHIS2 to strengthen cancer registration data systems in low-resource countries, from Rwanda to Jamaica, for the DHIS oncology module being piloted here in Jamaica. When we speak of NCDs, often enough, we know that cancers are among that group of diseases. But what do we really know about how cancers affect us in the Caribbean? Do we know about the geographical distribution? Do we know why certain cancers are more prevalent in various regions in the country? Do we know whether there are any linkages to age, genetic, or behavioral peculiarities of our Caribbean populations? Do we know whether there are environmental factors that predispose our citizens to certain risks? There are many more questions than we have answers for at this time. What I am pleased about is that we are making strides to have the basic tools available to us to be able to answer these questions, and then we will strengthen the systems needed to be able to respond with the most appropriate interventions. Surveillance systems are critical tools aimed at improving the early detection of diseases, but cancer registration is different. We collect, store, and analyze data for people who are already afflicted with this disease. Access to population-wide information on cancer incidence is critical for many reasons, including understanding cancer burden, planning and monitoring of national cancer prevention and control programs, and defining priorities in cancer prevention, treatment, and care. As this project aims to improve cancer control through the operationalization of a data collection and reporting system, it will improve the availability of national cancer data, which will help guide cancer prevention strategies and control programs. Specifically, the project will install, customize, and test an oncology module using the Health Information Management Platform District Health Information Software version 2. That's what DHIS2 stands for. To enable population-wide reporting on cancer burden by the National Cancer Registry right here in Jamaica. We are all too familiar with the challenges that make paper-based medical records vulnerable or difficult to cross-reference and analyze. Unfortunately, there are still many health institutions with sources of critical public health data that are paper-based. These installations will be done at many health facilities across Jamaica in a more efficient manner with the elimination of the paper-based method currently being used. Jamaica, you should be excited, as we are at CARFA, that you will be the second to pilot the DHIS oncology module. Never mind you're accustomed to being first. It means that you will also be CARFA's eyes and ears on the ground to document improvements that others can benefit from in our region, because the success of implementation of the module will have implications for its use by others. As we expand and strategically enhance the establishment of other registries in the region, we hope that this module can be identified not only as a tool to support the development of the sub-regional cancer registry for the OECS and the wider Caribbean, but a best practice. CARFA wishes all involved in this partnership every success and looks forward to seeing the results of this great initiative in the near future. I thank you.
Thank you very much, Dr. St. John, and thank you, of course, to CARFA for their continued support and partnership. And of course, we believe in partnership in public health. So we're going to have greetings now from Dr. Magdalena Pachkowski. I've been practicing it, the whole time. I've been practicing it, right? She is the Director of Cancer Registries for the Bloomberg Philanthropies Data for Health Initiative at Vital Strategies, and we're going to see her online. She's joining us online So please make her welcome as she brings her remarks. Nawama Phil, all right. So she leads the Cancer Registry Program in supporting selected countries in establishing and bolstering population-based cancer registries to track cancer data, which allows countries to better understand the burden of prevailing cancers within their borders and respond effectively. All right.
Thank you. Can you hear me? Oh.
All right. We can hear you, but I'm going to do the overview first and then come back to Dr. Pachowski. So I'm going to invite Dr. Armstrong while we work out some technical challenges. So Dr. Heather Armstrong is the head of Chronic Disease and Injury Department and principal investigator for the Caribbean Cancer Registry Hub. And so I invite her at this time to give us a project overview. Please make her welcome.
Thank you, Master of Ceremonies. And I have a short story to share with you regarding the origin of this particular project. It will just give you a brief overview of how it all started. And I wish to acknowledge Ms. Sarah Questel-Cooks, the program coordinator, for putting together this particular presentation. And when we look at cancer registration in the region, we note that with regards to population-based cancer registries, there are very few of them. And if you had to review the IT applications being used, we'd find within the English Caribbean that the CanReg 5 application is the most likely application to be used. However, in some of the Caribbean states, they recognize when they try to do remote collection of information that the CanReg 5 did not meet that need. And in 2020, CARFA decided to investigate what other applications were available to fit this need or to fill this gap. And through this exploration, we had the development of the Innovate project with the main objective, that is to find applications that could improve cancer registration globally. But of course, the particular application that we paid attention to was the DHIS2 oncology module. And this is a module that allows the collection of cancer data from remote locations. And we note that Rwanda was the country where this particular application was developed. And it allowed them then to be able to collect that data in an effective manner. And we note from this particular application it's customizable, and it includes logic checks, which allows us to validate the information that's being collected. So there are several reasons why the DHIS2 oncology module fits the need for the Caribbean. First of all, it is open source and is low cost, something that we are happy about. And in terms of the ability for it to meet the needs of the Caribbean, in terms of collection, we can tick that off. Also, it can work with the vital strategies. And in terms of implementing partners, we have the Ministry of Health and Wellness, Jamaica, and of course, CARFA, noting the roles that each of these partners will play in this particular project. And this slide, don't get overwhelmed by the steps, but it's just a visualization of where we're going upward and onward, and I would dare say to greatness. In terms of some of the activities that we are included in the project, and as you can see, it begins with orientation with regards to the use of the DHIS2 and the role that we play in cancer registration, to the point where we can adjust the module based on user testing. So we're going the full gamut of being able to test this application in real time. To help govern the process and make sure that we reach our goals and that we're successful in this project, we've established a project steering committee. And as I said, this project steering committee will provide oversight, guidance, and decision-making support for the project. And as you can see, it consists of personnel from, including IT specialists and public health professionals from the Ministry of Health and Wellness, Jamaica, and CARFA. And of note, we iterate the primary objectives in terms of making sure the project aligns with the respective organizational goals and objectives. We're able to monitor our progress, and they are also able to provide strategic direction and make key project-related decisions. So again, just a quick glimpse of the timelines, starting in 2023 and ending in Q3 of 2024. And therefore, as I end this brief presentation in terms of the project and what it will bring to cancer registration in the region, I just want to leave with you the project output and outcomes. So we have implementation and operationalization of the National Cancer Registry data system that can facilitate data entry from 4 regional health authorities, also data analysis and reporting of both at the region and at the national level. And of course, very important, access to population-wide information on cancer incidence, being critical for many reasons: understanding cancer burden, planning and monitoring of national cancer prevention and control programs, defining priorities in cancer prevention, treatment, and care. Thank you.
All right, thank you very much, Dr. Armstrong. I think we're ready to roll. We're good to go. All right, we're going to go back to the remarks from Dr. Pachkowski. So just want to make her welcome again. Go ahead, Doc.
Great, thank you so much. Well, good evening and welcome to all distinguished guests and colleagues. My name is Dr. Maggie Pachkowski, and it's really my honor today to give remarks on behalf of my team and program, and I thank you very much for this opportunity. I wish I could have been there in person, but unfortunately, I was not able to go, and one day I will visit. It's on my list. This program is implemented by Vital Strategies in partnership with Bloomberg Philanthropies, the International Agency for Research on Cancer, the African Cancer Registry Network, Tata Memorial Center in Mumbai, the National Cancer Center Institute for Cancer Control Japan, and of course our country partners. Together, we have implemented activities to strengthen population-based cancer registries in 8 Bloomberg Philanthropies Data for Health focus countries, and have expanded our reach through the Global Grants Program to an additional 9 countries. In addition, we have supported and continue to support 3 IARC GICR, that's Global Initiative for Cancer Registration, collaborating centers located in Africa. Our activities have focused on strengthening human resource and infrastructure to support cancer data collection, technical assistance to inform standard operating procedures and strategic planning, as well as training on cancer registry methods and principles, including CANREG 5, which you've heard has already been mentioned. We have also collaborated with our partners on a series of global goods. And this work has included this new DHIS2 oncology module that you are here to learn about today. And that was created through working with IARC the Rwanda Biomedical Center, and the Rwanda National Cancer Registry, and CARFA, among others. This foundational work will now be strengthened through this GGP support to implement this new module with the Ministry of Health and Wellness of Jamaica and CARFA. And so my team and I look forward to this new collaboration with CARFA and the Ministry of Health and Wellness of Jamaica to strengthen this data collection, and we wish the team a successful collaboration. Thank you for your kind attention. That's all I've prepared to share with you this evening.
All right, thank you very much, Doc, and thank you for the support from Vital Strategies. So at this time, I'm going to invite our Minister of Health and Wellness, Dr. the Honorable Christopher Tufton, to give his remarks. Please make him welcome.
Thank you very much, Stephen. And I just would like to say to Dr. St. John and our visiting friends, this is no way to spend time in Jamaica. Locked up in this room from this morning when I came at 9 o'clock, and you're still here. I'm sure there's a very chilled red stripe beer waiting for you downstairs on the ground floor. And I'm going to give you permission just this time. Just make sure you don't have more than 2. After that, we're good to go. Okay? Just 1? Okay, fine. All right, so listen, let me just welcome all of who are here. Yes, it is the second time I'm here. And I have one more event before I can relax. All the way at the University Hospital of the West Indies. Hopefully we can maneuver traffic to get there. But nevertheless, this is a good occasion. Dr. St. John and her team, Dr. Spence and her team, the other distinguished persons who are here, including IARC Caribbean Cancer Registry Hub, and we have Dr. Armstrong, of course, who is the principal investigator. And then we have Bloomberg Philanthropies Online, who just spoke. I really want to commend them and their involvement in these initiatives. Really had a great working relationship with them on this sugar-sweetened beverage. And I do take note that they're still very active with the Heart Foundation, and we fully endorse and support. So please give our regard to your sponsor, primary sponsor, and to the rest of the team. Where I believe you are in New York, I think, or wherever else. All right, so we endorse what is taking place here, and I have a prepared text, so I'm going to read it, just not to be long-winded. How is that? Normally I don't. So I'm pleased to join this evening for the official launch of the project that is important as it is timely. The current cancer burden in Jamaica and elsewhere in the Caribbean is stunning and requires our collective and urgent attention, beginning, of course, with our attention to data. In fact, today, Dr. St. John, after I left you here, I went across the road to the launch of the National Health Fund's addition to the 17 categories of illness that they provide medication for. We added 5 categories today. Included in that was colorectal, lung cancer, no, what's the other cancer? Well, multiple myeloma, yeah, and Parkinson's, and thyroid disease, right. So cancer is a big issue for us. That is going to be about 450 million Jamaican dollars, do the math, 150 to 1 US, and about 50,000 Jamaicans will benefit from this. So cancer is a topical issue, not just today, but has been for some time, and it is regional. In April 2023, publication of Jamaica Vitals, which is our data-driven newsletter coming out of our epidemiology unit in the Ministry of Health, says that the NCD addition for cancer is shown to be the leading cause of death in the island, accounting for some 23.7% of non-communicable diseases and 18.9% of all deaths in 2020, an estimated 7,348 new cancer cases, 4,746 cancer deaths in 2021. That's quite significant. Breast and prostate shown to among the top 6 leading cause of death. Over a decade, 2010 to 2020, breast cancer increased by some 63%, and prostate by 25%. And that is moving in the wrong direction, and it justifies what we're trying to do here. Review of pediatric cancer incidence in Kingston and St. Andrew alone in the early 80s to 2002 revealed some 272 cases. So it affects the cohort right across the population. Of note is that compared to the rest of the Caribbean, Jamaica has a similar risk of developing cancer before the age of 75 years. I did speak of our similarities this morning on nutrition and activities and so on, many of which are contributing factors to cancer. But we have a higher risk of dying from cancer before the age of 75 years in both men and women. Some of that may be due to not screening and late detection. All of this data can be used, therefore, to inform policymakers and to allow us, policymakers and their partners, and to allow us to intervene in a manner that is deliberate, that's calculated, that's planned, and that's intelligent. And this, of course, is our objective in order to reduce mortality rates due to cancer by 1/3 by 2030 through this population-based national cancer registry. It is vital, it is important, and it is something that we need to endorse. So it's all of this is sets the background for the National Strategic and Action Plan for the Prevention and Control of Cancer, the improvement in data collection and the utilization within the National Cancer Registry, and the Ministry of Health through its regional health authorities will be providing, of course, the critical data to ensure that this takes place. So the D4H grant, the regional health authorities oncology-related data is currently entered into the open source CanReg 5, you spoke to that earlier, and through the IARCA, Caribbean Cancer Registry Hub Initiative, provide on-site technical support for the installation and implementation of this particular system. And this has served the purpose up to a point. We're now advancing that cause, which is a very positive development. So this project that has been overviewed and spoken about is intended on building on the capacities that we currently have and making it better. And for that reason, it's a very positive thing. So today we say, let us capture the data. Let us use the best possible technology. Let us use the partnerships that we have available to us. Let us share the experiences so that the lessons learned and the responses can be as effective as possible, and that we don't make the mistakes that one or the other may have made and would therefore want to learn from. Fully endorse this project launch and look forward to giving the full support of the Ministry of Health and Wellness and the Jamaican government towards this effort. Thank you very much.
Thank you very much, Minister. And of course, to seal the deal, I'm going to invite Dr. St. John to present Minister with the implementation and the commitment.
So I want you to accept this little token to represent this very important step in this project. And I hope you will accept it and know that Carter will always be Jamaica's friend.
All right, thank you very much again. Another hand for our project and our partnership. So we are officially ready, good to go. We have launched and we are stepping out now. So I'm going to invite Dr. Davidson to give us the vote of thanks. Dr. Tamu Davidson, she's a director of NCDs and injury prevention, and my cousin at the Ministry of Health and Wellness.
Okay, so I have the opportunity to say vote of thanks for this very long day. So without any further ado, I'm going to start with our with our guest here, all the way who are here from Trinidad, who have come all the way from Trinidad, Dr. Joy St. John, Executive Director for the Caribbean Public Health Agency. I'd like to thank Dr. Magdalena Pakowski. I hope I've gotten that right. Pakowski, I should. My apologies from Vital Strategy for your greetings. And of course, I'd like to thank the Honorable Dr. Christopher Tufton, or as affectionately known as Chris. Thank you. Thank you for bringing us this keynote address today. I'd like to thank Dr. Heather Armstrong, head for the Chronic Disease and Injury Department and principal investigator. I'd like to thank her and her team for organizing this event. And I would also like to thank the Ministry of Health, Health Promotion and Protection Branch team and our NCD unit team for really supporting this event. They're quietly sitting in an audience there, but this has been certainly a ministry-supported event. And I'd like to thank our chair, Mr. Stephen Davidson, for ably taking us through tonight in a very efficient time. For special guests who are online or media, our Caribbean visitors, our international partners who are here, ACC, PAHO, thank you for taking your time out of your busy schedule to be here. I know we have been here all day. This is our second event for the day, but as you can see from the statistics that NCDs is not just an epidemic, but a public health emergency that we have to deal with. So this is why you have seen this level of commitment that we can be in here all day, locked in this room, and now ready to go and enjoy the fruits of our labor. So let us not overdo it. Please remember those risk factors for NCDs and our healthy lifestyle. And we look forward to seeing you. And as I say, what Louise Bennett would say, walk good. Thank you, everyone. And I hope I didn't miss anyone out. Please don't be vexed with me. Thanks and goodbye.
Thank you very much, Dr. Davidson. Thank you to everyone again. Please enjoy the rest of your evening.